Welcome, everybody. Important information for Colorado today. First of all, we have joining us here today at the Colorado Department of Public Health and Environment, Jill Ryan, the Executive Director, Dr. Rachel Hurley, the State Communicable Disease Epidemiologist, Scott Bookman, the Incident Commander for this incident of coronavirus, Mike Willis, the Director of Emergency Operations, Kevin Klein, who is the Director of Division of Homeland Security, Stan Hilke with Department of Public Safety, Summit County Manager Scott Vargo, Summit County Commissioner Elizabeth Lawrence, Peter Banco, the President and CEO of Centura Health, and Representative Julie McCluskey, who represents Summit County in the state legislature. This afternoon, I was notified that we have the first presumptive positive case of novel coronavirus, also known as COVID-19, in the state of Colorado. Because testing was conducted at the state level, the case is called presumptive positive. It's called positive when it's verified by CDC, but so far our state lab has run approximately 93 tests that have come back negative, and there are 38 tests that are pending in the lab. We expect that CDC is running on about a 48-hour timeline, but we have every reason to believe that, of course, our state lab, which has been tested, is doing these tests correctly, and this one came back as presumptive positive and is now being sent to CDC for official confirmation. Here's what we know. The subject is a male in his 30s who was visiting Summit County from another state. He traveled to Italy in mid-February, where there was an outbreak occurring, and also a travel companion of his is a known case of testing positive for coronavirus in another state. Upon returning from Italy, he spent time at home, then he traveled to Colorado on February 29th via plane. He was asymptomatic at the time. That means when he traveled at the airport, when he was on the airplane, he was asymptomatic, which means there is a low risk of transmission, non-contagious when you're asymptomatic generally, and that's according to the latest information from the CDC. Therefore, there's no reason at this time to believe that other travelers were exposed per current CDC guidance. We've also been in touch with DIA, and we have shared the information that we have at this time. The subject traveled from DIA to Summit County in a rental vehicle and met with friends where they stayed in a condo in Summit County. We know that he was there for outdoor recreation, and we're confirming those details. On March 3rd, he developed symptoms and went to St. Anthony's Summit Medical Center in Frisco, which is owned by Centura. On March 4th in the afternoon, a sample was taken. Today, March 5th, the test was conducted at the state lab, again, with the positive result, presumptive positive result. The patient was advised for his health to be transported to lower altitudes. The patient was feeling well enough to travel in a private vehicle with his fiancée to Jefferson County wearing a mask. At this time, he is now recovering in isolation in Jefferson County. His fiancée is in quarantine. His close contacts in Colorado, including the two friends that were Colorado residents that were with him on this trip, have also received quarantine instructions, and the quarantine orders are pending for those two additional individuals. Public health practitioners are investigating and will attempt to notify anyone else who may have been exposed because of this case when necessary. We will have Peter Banco is here from Centura Health to talk about that side where the exposure was limited to 4 personnel at St. Anthony's, all of whom took the appropriate precautions and all of whom will be tested. I also want to make an additional announcement that as we were preparing this announcement, we received word of a second presumptive positive case here in Colorado. We hope to have details on that later today. That recently came back from the lab, and we expect to have details. It appears to be a non-connected incident to this first incident. So that's all we have at this point, and we expect to have more information later this evening. As we informed the public earlier this week, we have been preparing for and expecting this situation for some time. We have an incredible team in place to keep Coloradans safe and to contain the spread of positive cases by acting quickly. we can have a better outcome for Colorado. We've engaged the state's emergency response plan. We've opened the Emergency Operations Center, which is currently operating at level 2. And that means that we are going to expand testing so we can contain and isolate those who have become infected, anyone who is in the chain of contact with a known presumptive positive or positive case while they were in Colorado. And through our emergency response plan, we're coordinating with hospitals and universities to increase testing capacity. Current capacity at the state lab, 160 tests a day. That's with the regular shift. We can run another shift of people, and we believe even with the current resources, we can be somewhere between 200 and 300 tests a day if needed. And of course, we're working on vastly expanding that capability as well in the future, working with hospitals and universities. But we have the ability to at least do the testing for the people that are in the chain of contact in these situations. The more we can test, the quicker we can identify, the higher the likelihood of successful containment is. It's really that simple. Now, again, it's important to put this in the context. At least 80% of coronavirus patients recover after self-treatment and have mild to no symptoms. If they have symptoms, they can treat them with over-the-counter medications. But 20% of cases or so are more severe and might require additional treatment to avoid the risk of dehydration and for respiratory distress. We also know that older individuals and immunocompromised individuals are at a significantly higher risk level when it comes to most illnesses, and that would include coronavirus, and that would include the flu, and that would include many other illnesses. So again, a disproportionate number of the fatalities and the greatest danger to Coloradans is for immunocompromised and older Coloradans. There is currently no vaccine to prevent or to reduce the spread of COVID-19, but we do have some suggestions about how to protect yourself, and many of them are common sense, but that doesn't mean that they shouldn't be said over and over again, because it's important to hone up on what works to avoid contagion. Avoiding close contact with people who are sick, avoid touching your eyes, nose, and mouth, staying home from work when you're sick and keeping your kids home if they are sick, covering a cough or sneeze with a tissue and then throwing the tissue promptly in the trash, clean and disinfecting frequently touched objects and surfaces using a regular household cleaning spray or wipe, and very importantly, washing your hands regularly with soap and water for at least 20 seconds. Putting the soap on and really scrubbing your hands under water for 20 seconds after going to the bathroom, before eating, after blowing your nose, coughing or sneezing. And in addition, if you're using an alcohol-based hand sanitizer, make sure it's at least 60% alcohol content, and wash hands with soap and water. Coloradans get sick every day, and I don't want anybody to think that, to panic because of this. And if you have a fever, and if you have symptoms of a respiratory illness, such as a cough or difficulty breathing, so again, that's the symptoms we're talking about here. This is not a stomach virus. This is a respiratory virus. And if you've been in close contact with a person known to have coronavirus, or if you live in or have recently traveled to an area with ongoing community spread, and again, I encourage you to look at the CDC website in the internet for those details. In this case, it was Rome. We also have community spread in California and Washington State. If you can meet those conditions, then consult your healthcare providers. Healthcare providers, in turn, have been instructed to notify CDPHE and the CDC to determine if testing is needed, if it meets the standard and the protocol for that, and we move forward from there. At the end of the day, we have a very robust healthcare system in this state. We have a comprehensive plan in place. We've been preparing for this moment. We are now in execution mode of this plan. We have highly competent officials that are working to contain the spread, and I have full confidence in our state officials and health professionals to respond to this threat. We expect to continue to expand testing capacity, and even within the current context, we have the ability to test everybody who is in the chain of contact in this first case and in this expected second case, presumptive positive, that we will have more details on later this evening.